resist me here, here. Then you're going to go here, hand on your shoulder, elbow up, resist me here. I'm going to come here, palm down, come across the body, resist there. Yeah, it's very weak, lots of pain. Palm up, resist here, much better. Oh, excellent. So we're going to go through a shoulder examination today, whether this is on the field or with a patient that comes into our office with shoulder pain. This is the basic screening that we do to diagnose and treat shoulder conditions. We take the history of the patient, and then we ask the patient to point to where the pain is. In her case, she's kind of pointing to the side and back of the shoulder. The reason we ask this is because some patients will point directly to the AC joint, the acromioclavicular joint here. And it's a common condition to have AC joint issues and osteoarthritis. They might point to the SC joint, the sternoclavicular joint. They might point a few inches below the AC joint, and that cues us into bicipital tendonitis. And if they're pointing in any of these places, then we have an area to focus on, and we go down that rabbit hole with a series of tests, right? But she did not. Now we're going to look at range of motion. And particularly, we're trying to investigate whether there's a frozen shoulder involved here. So we're going to go through range of motion. So I'm going to have you lift your arms up to the side. Any pain when you do that?
To the very top.
In that same area on the side and back of your shoulder. Okay. And then we're going to do internal and external rotation like this. Good. How about to the front? If she had pain here, we might then go into like NIRS tests and do passive range of motion to rule out impingement syndrome. And then we're going to come up here, and this is really the range of motion tests that we're looking at for frozen shoulder. So typically frozen shoulder patients, they're going to be somewhat limited, maybe in external rotation, but particularly limited in internal rotation. So they're going to struggle to put their arm behind their back. So that'd be the next thing I'd ask. She can put her arms behind her back, fine. We've checked off AC joint, SC joint, bicipital tendonitis. We're not thinking impingement syndrome, and we're not thinking frozen shoulder. If we were, we would stop at any one of those points and then proceed with further tests. Next, we're going to do rotator cuff tendinopathy. So we're going to start with an empty can. So you're going to hold your arm out at a slight angle, kind of this direction. And you're going to resist me here. I'm going to push down. Any pain there?
A little bit.
A little bit in that spot. Okay, let's do the same thing on this side. Nope. And it's a little bit weak there. I feel some hesitation. We're going to go here for infraspinatus. Yep. I'm going to push in this way. You resist me. Any pain when you do that?
No.
We're going to do the bear hug test. So you're going to take this hand across to this shoulder with your elbow up and pretend there's like a $100 bill that you're holding on your shoulder there. Don't let me lift this hand up. Any pain there?
No.
So we're checking here subscapularis. Do the same thing on this. Elbow up. Yep. And then push down here. Don't let me lift up. No pain there.
Mm-hmm.
We're going to do the lift off test. So you're going to put your hand behind your back and then lift off and push back. Any pain there when you do that?
No.
Any pain there?
No.
No. So rotator cuff muscles, maybe a little bit of an issue with some supraspinatus stuff. We're going to continue with our tests here. We're going to go into labrum. So then we're going to take this up. OBriens Test is probably the best test for slap tears. So we're going to bring it across the body with the thumb down. This takes the bicep out of it. And then you're going to resist me here. That causes the most pain. Okay. Then we're going to flip it over, palm up. We're putting the bicep back into the equation. Resist me here. That's nice and strong, no pain. Right? In her case, she's testing positive here with OBriens, so we're thinking labrum tear. Incidentally, the side is where we typically feel slap tears. It's not in the front where the pain is. Most patients will complain side or back of shoulder or just deep pain in the shoulder. So this is the basic screen that we start with. Sometimes we might also have shoulder pain from a neck injury or a disc herniation or things like that. And we would go down that rabbit hole with neck tests and do Jackson's compression and maximal foraminal compression and check neurological symptoms, dermatomes, myotomes, DTRs, all that kind of stuff if we were suspecting that. So what does this look like in real time, up to speed? So a patient comes in, we ask where the pain is. Can you point to it? She points where her pain is. We'll have you go through a range of motion. Any pain with this stuff, put your hand behind your back, come up to here, rotate, hands here, resist me here, resist me here, here. Then you're going to go here, hand on your shoulder, elbow up, resist me here. Good. Do the same on the other side. Resist me here. Then we're going to come here, palm down, come across the body, resist there. Yes, very weak, lots of pain. Palm up, resist here, much better. So at this point, we're thinking slop tear. It's that quick, that easy. Again, if the patient has pain in different areas, then we proceed with tests or even imaging to kind of confirm what we're thinking. But that's what it looks like when we go through a shoulder screen here at PROFORM Chiropractic and Sports Performance. Now you know.